Bismillahirrahmanirrahim. Dear students, in the last lecture, we discussed the external features of the spinal cord. In this lecture, we will discuss the internal organization of the spinal cord. Before starting this lecture, there is an important announcement that from the next lecture, we will start the physiology of the nervous system. At the end of this lecture, you will learn the internal features of the spinal cord, like what is gray and white matter, from which segments sympathetic and parasympathetic fibers originate, what are different ascending and descending tracts, and their start and destination, respectively. In the last lecture of external features of spinal cord, we mentioned that there are 8 cervical segments, 12 thoracic segments, 5 lumbar segments, and 5 sacral, and 1 coccygeal segment. If we see the transverse section, the spinal cord is incompletely divided into 2 symmetrical halves by a dorsal median septum. And a ventral median median sulcus. The spinal cord consists of an outer layer of white matter. This is outer layer of white matter in each segment of the spinal cord. The relative size and configuration may vary according to the level of the segment. As we mentioned, the spinal cord consists of an outer layer of white matter, inner core of gray matter. Inner core of gray matter. The amount of gray matter reflects amount of gray matter reflects number of neurons present. The gray matter is relatively larger in the cervical and lumbar segments where it contains enlargements. These cervical and lumbar enlargements contains neurons that innervate limbs, both upper and lower limbs. The absolute amount of white matter is greatest at cervical levels and it decreases progressively at lower levels because descending tracts shed fibers as they descend downward and ascending tracts accumulate in the cervical levels. As shown in this diagram, the amount of, if we see the cervical segment, the amount, we can clearly see that the amount of matter is greater here. The reason we have mentioned in this diagram. We have mentioned in the last slide that the spinal cord is composed of inner gray matter and outer white matter. In the cross section, the gray matter is described as being butterfly shaped. The gray matter appears as being butterfly shaped in the center of each segment, are resembling letter H. The gray matter, as we can see from this diagram, it is composed of four linked masses. It is composed of four linked masses of gray matter, and the right and the left dorsal horns and right and left ventral horns. The gray matter that immediately surrounds the central canal. This is the central canal in which the cerebrospinal fluid flows. The gray matter that immediately surrounds the central canal and unites the two sides constitute the ventral. It constitutes the ventral and dorsal gray commissures. The dorsal horn of the dorsal, this is the dorsal horn. The dorsal horn of the spinal cord is the site of termination of primary efferent fibers. Is the site of termination of primary efferent fibers that comes from the different receptors like Pacinian corpuscle, muscle spindles, Golgi tendon organs, Ruffini's end organs, and free nerve endings. So all these fibers, they enter the spinal cord through dorsal horn on both sides, on the both sides. The tip of dorsal horn is separated, as we can see here. It is separated from dorsolateral surface of the cord by a small and thin fasciculus that is called tract of Lizard. In this tract, primary efferent fibers, primary efferent fibers ascend and descend for a short distance before terminating in the subjacent gray matter. In contrast to dorsal gray matter, the horn the ventral horn is in front of central canal, and the ventral horn contains gamma motor neurons and alpha motor neurons. Alpha motor neurons innervate muscles, while gamma motor neurons innervates muscle spindles. A small intermediate a small intermediate or lateral gray matter lateral gray matter horn is present between dorsal and ventral gray horns at thoracic and upper lumbar levels. This lateral gray horn, it contains preganglionic. It contains preganglionic cells for autonomic nervous system. Within segments, spinal segments T1 to T12, preganglionic sympathetic neurons within this lateral gray horn, they give rise to they give rise to sympathetic axons. They give rise to sympathetic axons, and these sympathetic axons leave the spinal cord within ventral roots and then travel to sympathetic ganglia via, as shown in the second diagram, they travel towards the sympathetic chain ganglia via the communicating rami. Within spinal cord, within spinal cord segments S2, S3 and S4, there are sacral parasympathetic neurons within the lateral gray matter, within the lateral gray matter. These neurons give rise to preganglionic parasympathetic axons that leaves the spinal cord within ventral roots, within ventral roots in the sacral segments, and from here these, in the last slide we were talking about the preganglionic parasympathetic axons that leave the spinal cord within the sacral ventral roots. After projecting from the ventral roots, these axons project to the pelvic viscera within the pelvic nerves, and these axons synapse on postganglionic parasympathetic neurons that supply the pelvic viscera. The cross-section of gray matter shows a number of cross-section of gray matter of spinal cord shows a number of segments, and each segment is called lamina, and each lamina basically indicates a layer of nerve cells called Rex's lamina, after the name of scientist who discovered these laminas. The spinal cord is divided into 10 laminas on each side. The dorsal and ventral gray matter of spinal cord is divided into 10 laminas on each side. First, we will discuss about the lamina 1. It is written in italics, lamina 1. The lamina 1 contains thin marginal layer of neurons, and this thin marginal layer of neurons respond to noxious stimuli, means pain stimulus or any stimulus that damages the cells, and the axons of the neurons from this layer, they cross to the contralateral, they cross to the contralateral side of or half of spinal cord. The second one is the lamina 2, that is also called substantia gelatinosa. This lamina is made up of small neurons, and these neurons respond to noxious stimuli also. The substantia gelatinosa, it contains abundant amount of neurotransmitter called substance P. It contains abundant quantity of neurotransmitter substance P, and it mediates pain signals. It mediates pain signals through spinothalamic pathways. Next is layer 3 and layer 4. These layer 3 and layer 4, these together are referred as nucleus proprius. The main input to nucleus proprius is from fibers that convey position and light touch sensations. Then is the lamina 5. This layer contains neurons that respond to both noxious and visceral efferent stimuli. Then is the lamina 6. This is deeper layer of neurons and it responds to mechanical signals. It responds to mechanical signals from joints and skin. Next is a relatively larger lamina, that is lamina 7. This contains cells of dorsal nucleus, also called Clark's column, and it is present. This Clark's column, it is present. It is present It is present medially in lamina. It is present medially in the lamina 7. The neurons from this Clark's column, they give rise to posterior spinocerebellar tracts, and also they give rise to they also give rise to large portions of ventral gray horn. The lamina 7 also contains intermediate lateral nucleus in the thoracic and upper lumbar segments, and these give rise to preganglionic sympathetic fibers, and they leave the spinal cord via the ventral roots and white rami to the sympathetic ganglia. Then comes the lamina 8 and lamina 9. These two layers represent motor neurons in the medial and lateral portions. The medial portion called medial motor neuron column, called medial motor neuron column. It contains lower motor neurons that innervate axial muscles. Axial muscles. The axial muscles includes muscles of trunk and proximal parts of limbs. The lateral portion contains also lower motor neurons, and these lower motor neurons supply distal muscles of the arm and legs. Then is the last lamina, that is lamina 10, and this lamina 10 represents small neurons around the central canal. Next, we will discuss the white matter of the spinal cord. As we mentioned that the spinal cord has white matter around the gray matter. For white matter, each part is termed as column. The dorsal column lies between the posterior or the dorsal, median, septum and the posterolateral and the posterolateral sulcus. In the cervical and upper thoracic regions, dorsal column is divided into a medial portion, this is medial portion, and into a lateral portion. The medial portion is called fasciculus gracilis with reference to the nucleus gracilis of the medulla oblongata, because the fibers from through this fasciculus gracilis they pass to the nucleus gracilis of medulla oblongata. The lateral portion is called fasciculus cuneatus or cuneate fasciculus, and fibers from the fasciculus cuneatus they pass to nucleus cuneatus of medulla oblongata. The lateral, this is lateral white column. This whole is the lateral white column, and as we can see that it lies between the posterolateral sulcus, it lies between the posterolateral sulcus and the anterolateral sulcus. The white matter of the spinal cord contains tracts. Tracts means the bundle of nerve fibers that pass either from a receptor to the brain or from brain to the effectors. Effectors means to the muscles and glands. So the ascending tracts, they are numerous, but the most important one are the dorsal column tract. Number 2, the spinothalamic tract. Number 3, the dorsal and ventral spinocerebellar pathway. Number 4, the spino-reticular pathway. The dorsal column tract, its function is to convey fine touch, proprioception, and these signals originate from the skin and joints. And the neurons of dorsal column tract, they end in the nucleus gracilis and cuneatus of the medulla oblongata, and from here these fibers they cross to the opposite side and then relay in the thalamus. Then are the spinothalamic tracts. These tracts convey sharp pain, temperature, crude touch, and these sensations are conveyed from the skin and the fibers of dorsal spinothalamic tract, they pass through the ventrolateral columns as is shown in this cross section. Then are the dorsal spinocerebellar tract. These tracts convey movement and position sensations to the cerebellum, and these tracts, the dorsal spinocerebellar pathways, these ascend through the lateral white column. Then are the ventral spinocerebellar pathways. These also deals with movement and position mechanisms, and these also ascend upward in the lateral white columns to the muscle spindles to the cerebellum, and these receive signals from the muscle spindles, Golgi tendon organs, and also from touch and pressure receptors. Then are the spino-reticular pathway. These convey deep and chronic pain sensations that arises from deep structures, and the fibers from these deep structures they pass to reticular nuclei of brainstem. Then are the descending pathways. The descending pathways are divided into lateral pathways and the ventromedial pathways. Descending pathways means these descend downward from brain to the effectors. The most important among the descending pathways is the corticospinal tract, and the function of corticospinal tract is to control fine motor movements. The function of second pathway of lateral motor system, that is rubrospinal tract. This tract arises from the red nucleus. This arises from the red nucleus and is as the this circle indicates, this descends downward in the lateral column, and it also controls motor movement. Then is the ventromedial pathways are the medial motor system. Among these are the reticulospinal tracts. These reticulospinal tracts pontine and medullary reticulospinal tracts. These descend downward from the brainstem reticular nuclei, and these are especially concerned with the control of spinal cord reflexes. Then are the tectospinal tract. As the name indicate, it arises from tectum of the it arises from tectum of the midbrain, and it controls reflex head turning. And as this arrow indicates, and as the name ventromedial pathway indicates, it descends downward in the ventral white columns. Thank you very much and stay safe. From the next lecture, we will start the physiology of the nervous system. Thank you very much for being with us.